I'd firstly like to say a big welcome to you all and a huge thank you to our patrons of Westfield Health for collaborating with us on this event. Westfield Health have been working with the Chamber for probably about 14 years now, and for the whole 6 years that I've been there. And they've been a brilliant partner for us, both for us as a Chamber and for our members that we work with too. Here at the Chamber, we understand that the importance of health and well-being, both for our own employees that work for us and our member employees too. We've got about 4,600 members, and collectively they employ about 446,000 employees, and that makes up kind of a third of the Greater Manchester workforce. And so we understand the importance and significance of using our platform to help our businesses look after these people. Today we're delighted to have Richard here with us. Richard Holmes is the Director of Wellbeing at Westfield Health. He's a health and wellbeing expert who has dedicated his career to improving people's quality of life. And so we'll be asking him some questions over the next hour to get his views and insights. Please feel free to use the chat function. We have some of our team on hand to answer any questions, and please put forward any questions for Richard into the chat too. Now, the reason we're all here digitally rather than in person is due to the ongoing situation brought to us by COVID-19. It's been a huge shock to the economy, a huge shock to the workplace and the people. And so, you know, taking it to Richard, what would you say is the biggest challenge that people face now?
Well, first of all, Lucy, thanks for having us on, and hi everyone, and hopefully today will be of value. But as Lucy said, any questions, just pop them in the chat box and we'll pick them up as we go along or at the end. Yeah, the biggest challenge, Lucy,
Yeah.
I think everybody knows that, really, isn't it? It's it's all about how we're adapting to what's now boringly called the new normal, which we know is not going to be the new normal in a month's time, 2 months' time. So I think the key challenge in adapting is different for different people. So, you know, for those on furlough, it might be sort of loss of purpose because we know work's really important for people. Others, it's isolation. For key workers, home workers, it may actually be overwork. We used to do a lot of work before this situation for organisations, supporting them in moving people back to home working, because there was a trend before this. And there were about 4 million people working from home before this situation. They reckon that's now 16, 17 million of us doing it. And that has its own challenges. But I think the key thing for everyone is just the not knowing.
Yeah.
Not knowing what's going to happen next week, next month, the month after. So I think that's the biggest challenge for all of us, is just getting ahead. We like to think as long term as possible, but we're having to work on a week-to-week basis, aren't we?
Definitely. And considering that a lot of these challenges are new for business leaders or HR professionals, what would you say is the best way that they can support their people at this time?
Well, I think, first of all, just recognise that human nature, we're wired this way, by the way, human nature is we like consistency and predictability in our lives. Mm-hmm. So when I've been talking to HR professionals, business leaders in these types of forums before, what they're saying above all, that people want clear communication about what happens next and what we can expect moving forward. But quite often, and it's quite stressful for all of us on this call, if we're in that leadership thing, the answer is we don't know. But I think what we found is that people really appreciate us being, as leaders, being honest to them and actually just saying, look, we don't know, but this is what we can do next week, the week after. We also need to appreciate as well within that different worker groups and different people within different worker groups will all have different needs in terms of the support they require from the organisation. So again, it's not going to be a case of us as leaders supporting our whole workforce exactly the same across the board. You know, we'll do things differently for those on furlough, those in the workplace, those working from home. And even within those groups, we might have to do things differently for different people. So we've just got to focus, I think, more on the individual than groups and teams.
Brilliant. And so if you had to narrow it down, which may be difficult, but if you had to narrow it down, what would be your top 3 tips right now to support employees?
That's a nasty question so early. Okay, top 3. I'd say again, from the feedback I've got from other employers working through this is, first of all, communication.
Yeah.
And making sure that communication is as clear and unambiguous as possible. I think people appreciate that.
Yeah.
Leadership is really, really important, and probably everybody on this call is in a leadership position. You know, we still have to have firm leadership, but in this situation, I think we have to be more compassionate than we've been in the past at times. Yeah.
Yeah.
Third thing would be support. What support are we providing for our people? That might be practical support in terms of surviving furlough, advice on working from home, or it might be more orientated to wellbeing support. You know,
Yeah.
we know that's really, really essential. And part of what Westfield's doing for your members and client organisations across the country is that we've got free support available, both to people on this call as employers in terms of advice as to how to deal with certain situations, together with free, if you like, packs of information that they can give to their employees.
Yeah.
We also are delivering a wide range of webinars on a whole host of topics, and with a focus at the moment in terms of returning people to the workplace. And part of the launch of that's happened last week was providing, if you like, a 3 for 2 offer. So get 3 webinars for the price of 2 to just to help people to start thinking about how they're supporting people. And I know Carol, who's on the call, will just post up a couple of links if people need access to that free or paid for support. It's available. But what about you guys? What the Chamber doing for members in Manchester?
So for us, it kind of echoes what we are hearing from you. It's the communication side of things. So especially internally with our members of staff, it's making sure that everybody is included and is understanding what's going on, what they could be doing to support themselves. We have often have welfare calls in team environments, or we have, you know, open Q&A sessions with our CEO so that people can hear directly from, you know, our management on how they see things working moving forward. And what we've also started offering both for staff and members is more extracurricular stuff. So like Pilates, meditation, things that maybe aren't centered so much around business, but do look at how people can then, you know, be a bit more mindful of their own well-being and take that time out. We're also introducing mental health first aiders for the first time. So I know that we're behind the curve with some businesses, but we've kind of identified that how important it is to have, just as you have health and safety for people to look after those who physically harm themselves. What about those people who may be struggling mentally, who need somebody to talk to? And I think that's super important, because sometimes people don't want to speak to their line manager. They might want to speak to somebody else about some of the issues they're having. And so that's something that we're working with. And then finally, and you know, you'll like this answer, but it is the service that we offer through Westfield Health. So we offer that to all of our members, but we also offer it to our staff as well. And that has the access to kind of the counselling, the doctor line and things like that. And I think it's just making sure that businesses and our employees know what's out there, because sometimes it can be quite a noisy space. And I think if you have access directly to a few key services or a few key support mechanisms, then that can really help people.
And that's a really good point. One of the things we've found, I've found talking to these places, people saying, well, there's so much out there, I don't know where to start. So if your members know that they can come to you as a sort of trusted source, then that's great for the members.
Definitely.
It's life a lot easier.
Yeah. And so what are the businesses that you're working with doing, and what does that look like?
Well, a number of clients are doing some fantastic things. And for those people that aren't aware, my role in Westfield as Director of Wellbeing is I lead if you like, all the non-insurance business. So you're used to having the cash plan. But the business that I lead and run is providing wellbeing services in the workplace. So whether that's managed gyms, we do that, whether it's workshops, whether it's campaigns, whether it's screening days, those types of things. But obviously our business is a live coaching service. And as you imagine, at the beginning of March, that fell off the cliff because it was all based on on-site services. So we've had to convert everything to remote delivery like this, in terms of coaching groups, coaching one-to-one on a whole host of wellbeing topics. So there's an awful lot that our clients are doing around actually coaching people to live a little bit healthier to us. And we all know that how important that is now. It's always been important, but I think organizations are more and more recognizing that actually an investment in the well-being of the people is good business strategy. So we've got clients doing a lot of things, whether it's physical health, whether it's mental health, because we know those two are integrally linked together, whether it's purely just on personal well-being for people, or whether it's actually us designing coaching programs to manage a specific business solution. So some of it's a little bit sort of off the curve. For example, we had a housing association last month come to us. They were having to get all their chippies, electricians, plumbers back into the houses to manage the stock. Obviously, that workforce was feeling a bit nervous about that. So we had we were commissioned to do a health leadership training program with the managers about how to have challenging conversations with their teams about challenging situations. So a lot of clients are and organizations are saying, well, how can well-being either provide the solution or be part of the solution to these business issues and challenges that we have? So awful lot of inventive stuff. What I'm also seeing from organizations, and it's worth everybody on this call just checking it out, is, you know, if you had services already in place before the situation began, you know, are they still fit for purpose? So rather than, you know, dashing out and bringing new stuff in, review what you've got at the moment. Is it working for your people in this new situation? If not, how does it need to be changed to fit better for people? And the other thing that organizations are doing really, really well is in terms of communication, particularly in line with well-being. But the good ones are really taking note of what we refer to as the cadence of communication. So rather than throwing everything in the kitchen sink at all their employees right from the outset, it's actually sort of not drip feeding, but having a plan of sort of well-being communications that are phased over a period of time, so it becomes a sustainable support for employees rather than just throwing everything at the beginning.
Of course, brilliant.
And
I think
organizations doing,
perfect. I think at the minute as well, mental health is a huge concern for everybody. What can we do simply and quickly to help with that?
Right. What I'd say to people, everybody on the call, okay, what's your mental health plan for the next 3 months? And there might be some people going, what? What's he saying? And by that, I mean, just keep it really, really simple. Don't think too far ahead. But what support are you providing for your staff now and for the next 3 months? Okay. Where are the gaps? What's missing? What can you bring in to support people? And actually then this time next month, ask yourself the same questions so that you've got a rolling 3-month program that's adapting to the situation and what people's needs are. And then focus on, right, if we've got that service provision in place, however limited it might just be sort of information sheets, free fact sheets from us going out to your people. It may be that you have an EAP service within your cash plan. It may be that you have mental health first aiders. We do a lot of mental health first aid training, but we also do a lot of coaching of mental health first aid teams once they've been trained, in terms of keeping them up to date with what they should be doing. And one of the things we've been doing over the last 3 months is coaching them how to deliver those services from a distance or remotely, because that's a complete change for MHFAs. So the other thing is, as well as those types of things, is how are you communicating your mental health support? Are you doing it in a clear, considered way? Are all your communications in one place so people know where to go if they need some support or help? And then the other thing I'd look at within that 3-month plan, as well as the services that you're providing, which might be extensive, might be small, that doesn't matter, is there's an awful lot you and your team leaders in your organization can do. So how regularly are team leaders communicating with their teams and individual team members? How do those team leaders discuss with team members how they're feeling? How do they understand what works for different individuals? So I think there's an awful lot we can do within our own organisations from a leadership perspective to actually make sure that those conversations are having with people in terms of their mental health and well-being.
Okay, brilliant, that's great. And what can we do to manage our personal feelings?
Oh, right, okay.
Just a tricky one,
Yeah.
but I think that's going to be useful.
But I think a lot of people's feelings are have been all over the place and continue to be so, because we're changing all the time, aren't we? And now we're all talking about returning to the workplace.
Mm-hmm.
So that what tends to happen is that starts to create sort of anxieties within us, because all anxiety is if you like a worry, a concern, or a fear, depending upon how extreme that anxiety is, in terms of what's going to happen in the future. Now that future might be in the next minute, the next hour, the next day, the next week, the next month.
Yeah.
Because we don't do uncertainty very well as humans, because we like being predictable. That sort of creates that anxiety, and often we tend to get anxious about and worry about things that we perceive that we don't have any control over.
Yeah.
I think if everybody on this call thinks about that, that's quite a clear thing to way to position it.
Mm-hmm.
We tend to find with people that are less anxious or more resilient to dealing with uncertainty, that type of thing, because we study those people to find out, right, what is it? What can we learn from them? Mm-hmm. They have a really positive approach to things that they can't control. Now, it's not, as many people think, them saying, well, no point in worrying if I can't control it, if I've got no influence, why worry about it?
Yeah.
That's a myth. What they're actually doing is they're thinking more positively. So they're saying, well, if I can't control that, what can I do to try and influence what the outcomes of that situation would be? Yeah. Or what can I do to actually adapt myself so that I best cope with that situation? And as soon as you start thinking a little bit more positively like that, mm-hmm. actually suddenly the burden on your shoulders just eases a little, because you realize you can actually do things about it. I mean, there's a number of things we can all do as well, just to manage our general anxiety, and specific things I guess I'm doing at the moment is I'm being really careful to manage my social media intake. Yeah. Because there's so much out there that is unsubstantiated and creates worry and concern. Mm-hmm. So again, be careful with your social media intake. I just look at the BBC News on my phone first thing in the morning with a cup of tea, and that's it, I'm done. Leave it at that. If things do crop up and it's causing you worry, then actually search out the facts. So gov.uk for anything mm-hmm. to do with COVID-19. NHS website is a fantastic advice support area that people can use. So get the facts, and also to sort of alleviate some of those anxieties and worries is, in general, just do things you enjoy. Mm-hmm. Keep your mind active, relax, remember your physical health. And I think one of the things a lot of people are getting positively out of the current situation is having a little bit more time to themselves, because we are working from home. And so how can we use that productively? Those types of things we're looking at.
Brilliant, thank you. We've had a question from Steve at Social Circle, and he said, do you think that employers have a duty of care to employees outside of their working hours?
That's an interesting one. We legally, we have a duty of care to our employees when they're at work. Now, if we've got them working from home, then we still owe them a duty of care working from home. I would say the good employers adopt a philosophy that they have a duty of care to support their employees in their life in general. Mm-hmm. And that really is the sort of, if you like, the cornerstone or the philosophy behind providing well-being support to people. It's about supporting them not just in their well-being at work, but their well-being in their general life, because we know you can't separate out home and work life, because we all complain about the issues that we get at work that we take back home. What employers will also say is, well, you lot bring a hell of a lot of emotional baggage from home into work. So it works both ways. So if we're going to have happy, healthy, productive employees, then we've got a duty of care to our own businesses to support our employees in the widest possible context. That's a great question.
Brilliant, thank you. And I guess thinking about, as a manager, employee morale and how important it is, especially when you're trying to kind of work remotely and manage a team remotely, how do you think the pandemic is affecting employee morale, in your opinion?
Yeah, that's an interesting one, because I think generally everybody knows the answer to that. It's morale's gone down a bit, but you know what? There's an awful lot of people out there that actually quite enjoying the new situation that they're in and working from home, that type of thing. I know I certainly am finding it really, really positive experience, because I normally have an hour and 40-minute commute to work and back every day. I mean, that's 3 hours I've gained back in my life every day, and I'm putting that to proactive good purpose. So it's working really well for me. I'd rather not go back if I was honest. But humans are social animals, so we don't do isolation well. We don't do movement restrictions well. So undoubtedly, those types of things are affecting us all, aren't they? I think we all recognise that. But again, on the positive side, what I'm seeing from a lot of employers is a real community spirit starting to develop within organisations and within the people within those organisations. Huge amount of really inventive social initiatives that organisations are putting on to try and maintain that social cohesion in employees. So whether you're working from home, at the workplace, whether you're on furlough, there's a whole host of social events going on that are knitting people together, and people are starting to almost relate to each other completely differently. I find it Zoom really good working from home. You just get to know everybody a little bit better because you see them in the home environment, and it just brings people closer together. So morale wise, I think I'd like to think if we treat it right, we'll come out on the positive side of things in terms of the benefits it's given us. But let's not lose sight of it. It's had a huge impact on an awful lot of people where their experience hasn't been as positive as mine, for example. We've got to recognise.
Of course. And you mentioned kind of the initiatives that companies are offering, but not everybody wants to be involved in those initiatives, or not everybody willingly partakes in them. So how do you support those that don't wish to be involved in the activities that have been offered to them? And is there a way that we can start to engage them a little bit better?
I think this is where we need to be really, really careful, actually, because just on a sort of serious note, just because we've had a great idea as leaders as what will be great for all our people, let's not assume that everybody will think the same way as us. So there will be people out there that don't want to get involved in these things, happy in their own environment. So don't think it's down to the fact that the way you're engaging them is not working. Just appreciate and respect. Some people just don't want to get involved. So keep on inviting them, but don't expect them to join. That happens with me, actually, if I'm honest, because we have on a Thursday a Westfield pub quiz on a Thursday late afternoon. I could think of nothing worse, to be honest with you. I've been arguing with them all day. Why do I want to talk to them on a quiz? Now, that's a bit of an exaggeration, but actually, it just doesn't appeal to me. I'd rather spend that extra hour spending a bit more time with my family. Now, that's not a right thing or a wrong thing. There's no value judgments there. It's just, that's what I prefer to do. I still keep getting the invites. I keep still politely declining. So, not a problem.
Okay, brilliant. And now if we kind of change tack now a little bit with the discussion and focus on the people on this call as individual employees themselves. And first of all, just kind of a broad question, if people are generally more healthy, will it help prevent them from picking up the virus?
Well, what we've got to recognise, and by the way, I'm an educationalist, I'm not a clinician, let me make that but a virus is a virus. So a virus, you know, if a virus decides to get you, it will get you regardless of how healthy you are or not. The key here is that the healthier and fitter we are as individuals, then the more resilient we are to that virus. So we'll still catch it, but the impact potentially won't be as great as it otherwise would. The likelihood is we'll recover quicker than we otherwise would if we were less healthy, less fit.
Okay.
I'd say that from a generalist point of view, because there are always exceptions, but that's the reason to do it. Yeah. Okay. So there's never been a better time to start looking after your health and well-being as now.
Brilliant. And just before we carry on down this route, we've just got another question here from Steve from Social Circle, and it says, for a medium-sized organisation starting with their wellbeing strategy, what are the top 3 benefits you would suggest to implement first, and why?
Top 3 benefits? Do we mean in terms of actual services there?
I think, yeah, benefits for the employees for their well-being.
Yeah. So first of all, I think the critical thing to do is understand what the needs of your organisation and what the needs of your people are. Yeah. And one of the things that we do is we have a research program that we can put in certain organisations that assesses what the health needs of an organisation are. But you'll probably have a good feel on it already for your organisation. So then tie your initiatives to that. You then need to look at, I would suggest 2 things. One, what do you put in place to actually engage people in the program and in their own personal health and well-being? Yeah. So one of the common things that a lot of our clients do is they adopt a service that we provide called the Health Calendar, and that provides each month a campaign theme on a different topic with sort of fact sheets, signposting posters, support agencies, that type of thing. So that creates an annual, if you like, engagement plan that actually starts triggering people's interest in certain topics. And then actually, depending upon what your employee and your business needs are, is then what type of simple coaching programs can you put in place to support people. And we'd normally encourage people, if this is number 2 and 3 now, 1 was the engagement program. Number 2 would be sort of coaching programs from a preventative point of view to support employees in their own personal well-being. And then the 3rd level would be, we know those coaching interventions with employees, whether it's nutrition, energy, resilience, stress management, those types of things. If the culture and the environment of the organisation isn't supportive of or conducive to people making changes to the lifestyle at work and at home, then they're less effective. So the 3rd area I do is what we call health leadership training for line managers. So that's sort of coaching line managers in terms of particularly focused on sort of mental health and resilience, and how they can support their people in terms of the way you work or how you support people in general to deal with things. Yeah. So engagement, employee coaching, management training in terms of health leadership. They would be my key 3.
Thanks, Richard, and thanks, Steve, for the question. So going back to kind of the focus on us as employees, how can we in our leadership teams or our HR teams actually start to support each other?
Yeah, this is a really common question, by the way. And I think everybody on the call will be feeling the same way. It's like, who cares for the carers? Yeah. So probably everybody on this call is really, really busy looking after their teams and their organisation, depending upon the size of organisation you run. Particularly, really, really pertinent for the small size businesses where it's the business leader is the owner as well. So really lonely. I've been there as well. They're really, really lonely positions when it comes down to this. So there is nowhere to look after us. Yeah. So what we're finding is an awful lot of people then reaching out to people in similar positions in other organisations to sort of, should I say, I hate the phrase buddy up, but you know what I mean, get together and actually just support each other, because quite often the best thing we can all do is just talk and get things off our chest, yeah, or express a worry, and somebody sort of then puts that back into perspective and it makes you feel better. So what's happened actually in other chamber forums we've done is people have, when we've talked about this, they've started to use the chat function to sort of go, well, this is, I'm a HR manager, I'm a sort of business owner, this is my email address. If anyone wants to reach out to me, then do so. So I just say to everybody on this call is you're all likely to be in that same lonely position. So if you want to reach out to others, just put the information up in the chat and use the rest of this session almost like a networking session to get support for yourself. Yeah.
Brilliant, thank you. And do you have any tips for how we can adapt to how we work with young children at home, because that's been a big issue for many people?
You know, that's a huge issue, and I think the biggest tip of all is, as leaders, we've all got to recognise that. That'll be easier for some of us than others. Less easy for someone like me, where mine have grown up and left, so I haven't got the challenge of how I deal with things during the day. And one of the things we did was we've just produced a big nationwide report on the current situation called Divided Together. Mm-hmm. And actually that's available from the Westfield Health website, and that's looking at how has this situation affected businesses and employees within businesses. And one of the biggest issues was childcare while still trying to work from home. Yeah. It was a real big division. You got views of people saying, well, actually, people working from home with kids, they're using the kids as an excuse not to do any work. You know, all these sorts of divisive things coming up. So we've got to be really careful as employers to have a feel for, if those issues and thoughts are happening in our workforce, then we've got to educate people that, you know, that's not the case. That people are in, we've all got different circumstances which are challenging, or we don't see as a challenge because we're coping with it pretty well. And we've just got to appreciate that we're going to have to support people in different ways depending upon their circumstances and how they are coping or not coping with those circumstances. Yeah. Mm-hmm. So a good example of that on a call, it's a month or so ago now, was somebody came on and said, I'd like to tell you what we're doing. And they were a sort of youngish couple, late 20s, with two very young kids, both working from home for different employers. Absolute nightmare, as you can imagine. So they got their heads together and they said, look, the only way we can do this is almost if we rota ourselves 2 hours on, 2 hours off. So one of them worked for 2 hours while the other looked after the kids for 2 hours, and then they switched. And they said, well, the only way I'm going to get our full week's work is if we do this for 6 days and then we have Sunday off as a family holiday. So they both decided this would really work well for them. So they went back to their employers. Both employers were enlightened enough to say, you know what? That's a really good solution. Is the other employer going to agree? Both agreed. They set it up and it worked perfectly. But both employers were also enlightened enough to say, listen, you don't have to work a 6th day to make your hours up. If you're able to, in the situation that you're in, if you're both able to work productively for that number of hours, that's fine by us. And we've got to appreciate that we can't have everybody doing everything all the time.
Yeah.
And that worked really well. But what made it work really well is both employers then showed the leadership to actually make sure that the teams that those two people worked for were fully aware of their situation, when they could be contacted, when they couldn't be contacted, why they were doing it that way. And you know what? The rest of the team all went thumbs up. Brilliant. They didn't say, oh, well, why can't I do that? Recognise that that's what needed to happen for that couple, but they didn't need to happen for them. So that type of thing we need to be looking at. There's a difficult one. yeah, really difficult one.
And just at the same time as kind of I asked that question, we got a question in the chat from Beth at the NSPCC. And she said, have companies seen an increase in the need for wellbeing support for employees who are juggling childcare under the current circumstances, and also the future uncertainties for childcare? She said she'd be interested to hear if this is an area that other businesses are interested in finding new ways to support employees with. So you've kind of touched on that, but is there anything else you've got to add?
Yeah, I wouldn't say, no, I say definitely what organisations that I talk to, you're absolutely right. It's high on people's radar now. Mm-hmm. If we've got really valuable, hard-working employees that are committed to us, that have always performed for us, they're now in a really tricky situation if they've got young kids, because there's no school, there's no childcare facilities. And so organisations, they haven't got, I don't think there are any set answers at the moment, apart from organisations looking at how they restructure how people work, how organisations manage their expectations of what people can reasonably be expected to do whilst managing childcare. So there's a lot of adjustments going on with organisations about how they feel about what they want from employees and how they support employees in performing at their best within the limited circumstances that they've got. And then I think organisations are starting to think about, okay, if this is going to go on for an extended period of time, what are we as employers going to have to look at doing to support employees with childcare duties?
Yeah.
Nobody's got the answer yet, but they're certainly starting to think about it.
Brilliant, thank you. And I think Beth said that they've developed some resources at the NSPCC to support employees with that, and they've been really well received. So that sounds interesting too.
So again, if you can put a link up on the chat there for NSPCC and where those resources are, so people can access them, that'd be fantastic. Yeah.
Brilliant, thank you. And then, so going back to kind of the employees, and you mentioned, you know, some people have managed to agree a rota whether they work 2 hours on, 2 hours off, and having that break is really important. So why is taking breaks when you're at home so important, do you think?
Well, taking breaks is important, full stop. And actually, if you think about it, you know, if you look at your employment contract, so if everybody thinks of themselves on the call now, not as a leader, but as an individual employee, if you look at your employment contract, you have breaks built into your working day, and you have what we call annual breaks, i.e. holiday or annual leave, built into your working year. And that was one of the earliest bits of health and safety legislation related to well-being, believe it or not. People don't usually think about it that way, because what that recognises is that we cannot operate 100% of the time, all day, all week, all year. You know, we have to have breaks to recover from work. So your annual leave isn't for you to go on holiday, although it's actually designed to provide you with a period of time where you can recover from work. Yeah. And that all reflects the way humans are designed to work. So for those of us with, if you can go back to your physics at school, we're designed to work in an oscillating rhythm, which is, if I can just, it's peaks of high intensity followed by troughs of rest and recovery. So we're constantly doing that. So humans are designed to work high intensity effort followed by rest and recovery. Yeah. So for example, you can look at that on an hourly, daily, weekly, monthly basis. So they reckon that the optimum concentration span for the human brain is 50 minutes, and then it starts to drop. So what's that say about those long meetings, by the way? So the ideal thing is, if you're working, is to work in 45, 50-minute blocks with then just a couple of minutes break. That's all it needs for your